Hi, everyone. Thank you so much for making time to join Meta's training today on choosing data collection methods. I want to note that all attendees are currently muted, but please don't hesitate to share your comments and questions in the chat box throughout. In just a few moments, I will walk through how you can do that. My name is Meg Gibbon, and I'm the Program Manager for the Monitoring and Evaluation Technical Assistance, or META project. I'm so pleased to introduce our speakers today. First, you might recognize Jamie Costigan, the M&E Technical Advisor who leads the META project. And second, I'm delighted to present Marie-France Guimond, who is the Research Systems Advisor at the IRC. She has 10 years of international experience in monitoring, evaluation, and research, including providing technical support, leading evaluations, and developing research tools. So we're very excited to have her join us today. Before we get started, I'll briefly go through a few logistics in WebEx. As I mentioned, we are really hoping for your participation throughout today's training. So when we ask questions, please click the hand icon to reply yes, or type out your response in the chat box. You can access that by clicking on the chat bubble on the top right of your screen. So I'll begin by reviewing today's objectives. After this training, our goal is that you'll walk away with first an understanding of why data collection methods matter for your programs. Second, 4 questions that you can ask yourself to help choose appropriate methods. And then last, a fundamental knowledge of when and when not to use various data collection methods like interviews, focus groups, observation, and surveys. And with that, I'm going to hand it over to Jamie to get started.
Great, thanks, Meg. So I wanted to start today by defining what we mean when we're talking about data collection methods. The term data collection methods refers to the different tools, and there are many of them, that we have at our disposal to help us systematically gather information that we need in order to design, monitoring, and evaluate our programs. Often when we're talking about data collection methods, you may hear data collection being talked about in relation to research. But it's important to keep in mind that data collection happens at many phases of the program cycle. So data collection is done as part of the formative research that we do to help us plan our services. Data collection is also done as part of ongoing program monitoring, and then it's done as part of our program evaluations. And the process that Marie-France is going to be talking about today for how to go about choosing the right methods, this is relevant whether you're collecting your data to answer your research and evaluation questions, or you're planning on how to collect data to answer questions as part of your ongoing program monitoring, like whether your program is progressing as planned and you're seeing the results you expected. So I wanted to put the question out to all of you for a moment and just kind of see some brainstorming here of what some of the methods are that you have used most commonly. And these could be methods that you're using for conducting formative research, like I mentioned, or program evaluation at the end of a program cycle, or even methods that you're using for ongoing program monitoring. So if you could just write some of those into the chat. I just want to get a idea of what are some of the most common ones that you're most familiar with. So I see pre and post tests, case notes, phone surveys, questionnaires. Okay, so a lot of surveys and interviews. Okay, great. So we'll touch on a few of those and go a little bit more in depth when Marie-France speaks later on. But we will also, we want to take note of any methods that you are really interested in taking a deeper dive into. So when you're filling out your surveys at the end, please note those, and we'll try to develop some resources to help you take that deeper dive into methods that you might be less familiar with. So there are many different types of methods. There's observation, the interviews, like many of you mentioned, surveys, focus groups, document reviews. Some of you might also have some familiarity with participatory research methods. And many of these, like I mentioned, we'll be touching on a bit today. But hopefully we'll have opportunity through other meta resources to be able to go into a deeper dive. Thinking about why methods matter. Of all these data collection methods that we have at our disposal, why do we really need to think about carefully how to choose methods? Why do methods matter? So I love this image of the evaluation tool and the peanut. Someone saying there's a problem with this nut. Has this ever happened to you where you've had a clear idea of what you wanted to learn, you started to collect the data, you realized that you weren't getting the information that you needed to answer your question? A couple of people, yeah, several of you. I mean, it certainly happened to me. It's certainly a challenge, and hopefully that's why some of you are here today, is to kind of help us move beyond this and make sure that we're doing this less frequently. And I'm sure that many of you can also provide some examples and lessons that you've learned from this process of trying out different methods and having them fail. So I'd encourage you to provide some of those examples and lessons that you've learned on the Meta discussion forum, and I'll post the link to that chat forum now. So the methods that we choose matter, but oftentimes there's not a problem with the nut. Oftentimes it is a problem with the evaluation tool. Sometimes there's a problem with the nut, with the question that we're asking and the data that we're wanting to be collecting, but oftentimes it's a problem with the evaluation tool or the data collection method that we've chosen. The methods that we use matter because they determine whether or not we're able to collect the information that we need. It also has implications for the conclusions that we can draw about our programs, and there are often budget implications as well. So now I want to hand it over to Marie-France, and she's going to give us some practical guidance on how to go about choosing the right data collection methods.
Okay, so choosing data collection methods. So first I want to start at the end. So the 4 questions that I want you to remember at the end. First, you need to think about what you want to learn and why. Second, what type of information you need and who can provide that information. And it's really only at the 3rd question that you start thinking about data collection methods. And then you think about, okay, so based on the information that I want, what data collections are most appropriate for that. And then finally, and this is something that Jamie already mentioned, data collection can be quite costly, or it can require specific qualifications. So that's also something that we need to think about. So I'll go through these questions one by one, but just so you know, we're not going to get into some really intensive, research stats or anything. They're just 4 basic questions that we want to be able to answer. Okay. So first is, what do we need to learn and why? And that sounds so simple in so many ways. But for example, you could want to learn about so many different things, right? You could identify needs and gaps with your clients that you have right now. You could want to determine which program is more effective. Like, for example, if your intention is to increase English language skills, what type of programming is most effective at doing that? You could want to gauge changes in the outcomes you expect to see. So again, like if you want to look at English language, did you want to measure the increase in English fluency? You could also want to check if services are being implemented according to plan. And a lot of that is around, for example, how we monitor the activities that we plan on doing and whether they're following the plan that we anticipated. It could be as well to determine why you are seeing the results that you're seeing. And this is going back to you have the wrong tool for the nut. I mean, for example, you could say I did a really good satisfaction survey, and we're noticing that people are very happy with one part of the program, but then they're really unhappy with a specific part of it. And you're wondering why, but a satisfaction survey you may not have asked that question why, so maybe you're not getting that answer. And then you could also want to know how people feel about your services. So there's a number of things that you may want to learn, and you really need to hone in on that first. So a question for you guys. So this is an example. So Sonia, casework in Tallahassee, by the way, Sonia is not real that I know of, provides intensive case management with a focus on health services. She ensures clients have health insurance, know their primary care physician, and visit specialists as needed. So what is one thing that Sonia may want to learn about this program and why? And just so you know, this is not a trick question. She could be wanting to know 30 different things. Yeah, so I'd like to get your your thoughts in the chat box. If you were Sonia working on this program, what might you want to learn about? And maybe think back to the previous slides in terms of, do you want to learn about any of these things? Do you want to learn about something else? So I'd love to get your thoughts on what you might want to learn. What % of clients are achieving these outcomes? Yes, great. Can clients schedule appointments on their own? Do clients trust their doctors? Yes. So all of these questions, right? How clients feel about ICM on health? Yeah, absolutely. Kind of perceptions, feelings of feeling confident or, satisfaction. That could be it as well. Are we meeting our own, if there's internal timelines that we expect to meet in terms of supporting those clients? Maybe that's something that we want to learn about. I see another one, characteristics of clients who are not achieving outcomes. Yes, absolutely. Excellent. So there's a large number of things that you might want to learn about. The second thing that you want to do is to hone in on specific questions. In my experience, one of the number one mistake that's done in evaluation is that we want to learn too much. So, for example, we might want to learn about all of the things that were just mentioned by some of the colleagues who are participating. So we could say we want to learn about how they feel about the program, what outcomes they're achieving, meeting the timelines, etc. And often that leads to a number of problems. One is that it ends up being very costly. Second is that we are struggling to come up with the variety of tools that are necessary to answer all of these questions because they require different methods. And also sometimes we come up with a report that's so has so much information, is so complex that it's difficult to then say, okay, what's the recommendation in terms of how we move forward? So I really want to emphasize this. I really think that really coming up with one main question and then some sub-questions under that is really key. And focusing on whether you want to learn about outcomes, people's feelings of satisfaction, if you want to learn about needs, then, try to really kind of make it as, make it fairly narrow. And then in terms of, once you have all of these questions, and in my experience, again, people tend to have a lot of questions. Isn't that an issue that people don't have questions? So to narrow down those questions, then you're asking, is it important and actionable? So basically, if I'm answering that question, how will it help me change the program that we have right now? And if you think that it doesn't, then think about whether that's the right question to ask. And also that has been answered before, and that sounds so kind of straightforward, but yes, I mean, sometimes it happens that we will go out of our way to collect information, and then we realize that that was actually already available in the monitoring data or elsewhere. So that is something to think about as well. All right, so next question. So what type of information do we need and who can provide it? So first of all, what type of information? So again, like some of the examples that were brought up in terms of what we want to need are really about opinions, attitudes, and perspectives. So for example, when we ask people about, what is your level of satisfaction with the service? Do you feel comfortable in the training? Do you feel like your community is accepting of you, et cetera? I mean, that's really kind of around, opinions, attitudes, and perspectives. But you may also want to learn about information that is precise, standardized, and quantifiable. So, for example, you may want to know how many people have increased their English fluency scores, how many people are getting health services network frequency. And it could be, in many cases, often it's a little bit of both. And as long as you have clear-cut questions that you're asking, then of course that's fine as well. A lot of studies will look at a mix of both of these as well. And then again, this sounds like a very straightforward question. Who can then provide you with that information, right? So clients, do you have existing programming monitoring data, community members, staff, official government statistics? And just to give an example of sometimes, even if we're thinking that we're doing this correctly, sometimes we can get this wrong. So it's often quite typical, for example, that our first reaction is to say, let's for example, do a focus group with clients on a particular program. Recently, I was handed over an evaluation that I then had to move forward, and one of the main questions was, how are the staff working together to make sure that this holistic program works together? So it had a cash component and it had a protection component. We actually, there was no plan to actually talk to IRC staff about this, yet they're the ones that had the most information about how well they worked together, yet we had failed to do that. So this is just like a simple example of where sometimes we just fail to think about who actually has the information, and we are missing out on key sources of information. And don't also underestimate the use of existing documents, program data, official government statistics. I'm sure you have a lot of information existing, case management, and that also needs to be mined as well for that information. Okay, so now let's get your feedback on this. So what do you think? So Sonia has noticed that of the clients who receive prescriptions for medication, men are more likely to get their prescriptions filled. Who would Sonia speak to in order to learn why? Again, there could be multiple. Yeah, somebody wrote, speak to women alone without husbands. Yes. Separate focus groups with men and female clients, absolutely. Yeah, one of the things that here, obviously we need to think about the gender component between men and women. Do we need to talk to service providers? I mean, maybe not. But yeah, mainly I think we want to talk to the clients themselves and just make sure that we're making that kind of gender specific as well. Okay, so I'm from a research background, and we tend to make things complicated for ourselves. There's, we use a lot of terms to describe things, but really a lot of the main methods fall into two big groups. Does somebody have thoughts on what those two groups, so in terms of data collection methods, are typically classified in two? Yes, exactly. So qualitative and quantitative. So yeah, so qualitative data and then quantitative data. And this is something that I often do when I'm working with team on developing an evaluation, is that I like to show them what the difference is, because we all know what the difference is in our heads, in the sense that we know the qualitative is like a description, quantitative is about numbers. But for example, if you have a qualitative report, it might look like something on the left, right? So I'm not going to read it out, but it's basically about people talking about, their feelings, their history. We could be asking people's personal history about coming to the U.S. and what that experience has been like. So it's quite descriptive. And then we often group them in themes in terms of how, the themes that come up. And then on the quantitative side, we could have something like 74% of clients received health insurance within 90 days. That's a very different type of information, and the report will look very differently. So often I like to think about the end product and what we actually need to action, what we want, like the change that we want to make, and whether it's more the type of the information on the left that's going to help you adjust programming, or whether it's information on the right, or to what extent is it a mixture of both. Probably several of you already know the difference between qualitative and quantitative. So qualitative is really about kind of nuanced and complex information that answer the why, how, and under what circumstance. It's about opinions and attitudes and feelings and priorities, and also looks a lot around behaviors. So why people do a certain thing versus another. It's also a really important tool to look at sensitive topics, which are things that you might be dealing with as well in your programming. So it's often much easier to talk to someone in person rather than have to answer a form, and also seeks depth of understanding on the topic. Now, in terms of the quantitative, it's really about kind of precise, easily quantified information, and standard information, right? So if you want to count the number of people from a particular country in your caseload, if you want to look at the scores, but it's going to be standardized across the groups, and it's really about clear, well-defined issues. They're about information about the nature, size, and frequency and distribution of a problem. And also a big difference between the two is the qualitative is great when you're open-minded about finding unexpected things. Like maybe you didn't, like an example actually that Jamie was giving me the other day is that there was maybe in a class we were wondering why men and women had different scores, and it was noticed that women often brought their babies to the training. So that's something that we did not necessarily expect if you're not in the class looking at it, but it's something that would come up if you're doing some qualitative research on it. Whereas with quantitative, you need to already have your predefined categories for what could be happening. So, and I'm going to focus on these 4 methods. A lot of you have done several of these, starting with the left-hand side. So interviews are, one-on-one open-ended questions. And by open-ended questions, I mean there are questions about, for example, what do you think about the English language program? How did you feel when you first went to see a physician? And it's really letting people answer at length and descriptively about what is happening. So the next one is focus groups, and I tend to find that focus groups is one of the methods that's often used and not necessarily in the best way possible. Focus groups were largely developed around marketing. So when you think about kind of, if some of you have watched Mad Men and how they test products and they bring people in and they watch them interact with the product, that's kind of the idea of focus groups. So it's a lot about asking people about their thoughts around a service or a product. You want the groups to be homogeneous. So again, somebody mentioned do separate focus groups, for example, with male and female clients. That's very typical. Depending on the people that you work with, there might be, you might want to bring people together with similar language skills, for example, so they don't feel as intimidated to speak up. But the idea is to use focus groups, especially where you have a service or a product where people might influence each other, for example. So if you think that if a couple of people start thinking, okay, well, this is working really well, we're going to participate a lot, et cetera, and that might influence others to join in and also participate. Focus groups are a really great tool for that, and they're good to look at dynamics as well. So, for example, if you think if you think, for example, that people who have better English skills might participate more in the courses, et cetera, and you want to test that out by watching how they interact in focus groups, that's another way to use it as well. Next, observation. Has anyone used observation in the attendees? It's one that's not, I find it tends to be underused as a method. It could be, for example, this is something that we do in international programs, for example, for teaching, and it could be the same for training in your case, where you would have someone sitting at the back of the class that could observe, for example, where people are sitting. Are they sitting together? Do they tend to sit next to people of certain ethnic origins? Is the instructor speaking loudly enough so we can hear them in the back? Things like that, right? So observation can actually be quite helpful. It can actually show you, a lot of things that you may not notice. There are things that people don't even realize that themselves that is happening that could affect how people are engaging with the program as well. And then finally, service and assessments. So as opposed to interviews, which tend to be open-ended questions, of course, surveys are closed questions. So here you're asking questions where there's either a yes/no answer, a multiple choice, or something like that, like something that can be easily compiled. This does not mean that you don't have, for example, an interview, sometimes a closed question, like, for example, how old you are, or sometimes in those survey questions, we may have an open-ended section where we say, and here you can answer your comments. So they're not completely mutually exclusive, but typically, so surveys is basically going to be closed questions. So yes, no, multiple choice versus interviews that are open-ended. And one of the things with surveys and assessments, and for several of you who have done them, is that they're really great to measure outcomes, to collect information about scores, things like that. But they don't tend to get to the why and why things are the way they are. Questions so far. Can observations be perceived as biased data? So if by that, and do correct me if I'm misunderstanding, if you mean by that having an observer in the room can bias how people act, yes. And in fact, we'll get to that. So it's one of the trade-offs that you're making, because yeah, people typically, it's called the Hawthorne effect, typically act differently if people are observing them. We all do that. One of the ways to mitigate that is to observe for a long period, and then people tend to notice much less that you're there. That's something that's used, for example, when you have like the anthropologists that would go to far communities in Brazil, they would stay there for months at a time to observe. But if that was, and do let me know, Caroline, if that was your question, it is indeed a con or a trade-off to that method. Are quantitative methods always more authoritative? That's a really good question. So, and it always depends on what the information that you're looking for. So quantitative methods are more authoritative if what you're looking for is, for example, I want to know if we've managed to increase English language skills. It's going to be much better to test them and assess them than to just ask them, do you think that your English is better? Absolutely. Within my team, we do a lot of what we call impact evaluation, so that we measure a large group of people who don't receive the program versus a large group of people who receive the program, and then you can measure statistically if it's actually the program that's making the difference. So in that way, it's more what we would call rigorous. However, there's a lot that you can't answer with qualitative methods. If you're having some issues with, for example, some people are feeling that they're not feeling integrated in the community, you're trying to see what you can do, work with community leaders, a lot of that will come out much more with qualitative methods. It's going to give you much more nuance, it's going to be much more complex. You might have a lot of unintended information that comes up that you can't box it, right? Because you didn't even think that some of these issues were coming up. They really meant to answer different types of questions, and to use surveys when what you're trying to understand is things like integration into your community. You're trying to understand stories around that. Then you're actually not going to get the information that you require, and that's really what we want to focus on. So some examples to give to you. So for example, interviews. So Samir wants to know whether case management services could be improved. Do they meet client needs? Are they culturally appropriate, respectful, and accessible? He decides to conduct exit interviews. So this is an area where an exit interview is quite appropriate, because we're not just saying, are you happy, yes or no? How often did you come per week, 1, 2, or 3? We're asking questions around, culturally appropriate, respectful, and accessible. Those are much more about opinions and feelings and things that might also be sensitive. And especially when you're looking at some information that could be sensitive, one-on-one interviews is often the way to go. Even focus groups sometimes, most of the times they're not appropriate, because some people may not want to speak up about some of these issues unless they're with a group of people that they fully trust and feel like they're quite similar to. So pros and cons, and by the way, I think that Jamie's working on a sheet that summarizes a lot of this information, so don't feel like you need to rush and write everything down. So pros of interviews, I mean, they're great for gathering feelings, opinions, attitudes, and experiences. Again, great for sensitive topics, and you go in depth. But it's not generalizable information, right? So that question of whether it's more authoritative or like rigorous, I mean, it's not going to tell you what the whole of the group thinks about. It's going to tell you what that particular person is feeling. And also, there's always this question of bias. And in almost all methods, there's going to be bias. But the more you're interacting, the more there's a risk that because you're asking open-ended questions, that you might accidentally ask a question that leads people into a certain direction. And that's something that I think that Jamie maybe has some tools around, like in terms of interviews. I mean, there are ways to ask make sure that you're not asking leading questions as well. Now, a focus group. So Karen notices that women don't seem to be attending English language courses as regularly as men. And then you have participation data that confirms it. And she decides to conduct focus groups separated by gender to learn why. And again, this is, focus groups, this would be a typical use of it. It's about getting people's feedback on a service or a product. You are here too, separating them kind of in particular groups here by gender. A focus group, usually it's 6 to 12 people is what's considered optimal, and then you're getting their feedback on this. So again, pros and cons, again, they're good for gathering feedback on a service or product. It also tells you about group dynamics, so who might influence the others to participate in class or not participate in class, those types of information. It's pretty flexible. Again, you might get, have unexpected topics come up, which is often really interesting. And it's low cost because you talk to a lot of people at the same time. But also, it requires a good facilitator. You will probably notice that some people speak a lot, some people speak much less. And also, it's not generalizable, and you have a lot of information. Sometimes it's difficult to compile and analyze in the right way. Observation. So Elijah hears from a local employment partner that many clients aren't correctly filling out the online application. He asks clients permission to watch them complete the application and talk aloud about what they think. So a little caveat here. Somebody mentioned, Carola mentioned the bias. So especially here, because the client is very aware that someone is beside them, because they're even hearing the client think through the form. Of course, there's some level of bias, but this is actually something that's often quite helpful, because sometimes, like for example, if you're filling out a form and it just frustrates you, you may not remember a few days or a few weeks after what part was confusing and why you stopped filling it in. But if you're watching the client go through it and then they say like, oh no, this is just too much or too much information, they can tell you right away. So it's kind of a modified form of the observation, but could be quite helpful. So here again, it's about behaviors and actions studied in real time. May reveal problems or patterns that people are unaware or unable to describe in interviews. But again, there's this question of observation bias, and they may behave differently because you're right there. Surveys. Caroline wants to learn whether extended case management reduces dependency on social services more quickly than case management provided only during the R&P period. And again, to assess client outcomes, she will conduct client surveys at 90 and 180 days. So surveys are great to look at outcomes. They're easy to quantify. They can be generalized if you have a large sample. In this case, we want to make sure that we look at both the people who do extended case management and case management provided only in the R&P period. But survey design is actually hard to do. A good survey, asking the right questions, is difficult to do. There's an art and a science to the order of questions and whether you're asking a positively worded versus a negatively worded questions, what kind of scales you're using. So there's actually quite a bit that can be a little bit tricky if you're not using a standardized survey. And also, it doesn't really tell you much about why and under what conditions. And they tend to be costly because they tend to be asked to a lot of people. All right. Again, what do you think? So Sonia has noticed that the clients who receive prescriptions for medication, men are more likely to fill them. She wants to understand why and has decided she needs to talk to women. but what method should Sonia choose? So earlier somebody had already said focus groups. Anybody has other ideas? So here, I mean, there are a couple of different ways, and especially if you think that this might be a sensitive question for whatever reason, you could use interviews. And again, you want to maybe especially talk to women, but you might want to talk to both men and women and see the difference between the two. Focus groups can be quite appropriate, especially if you're not talking about sensitive health issues. It could be that observation could be helpful as well. Again, it could be a bit strange because it means, in this case, it could mean that you're actually going to the clinic and seeing whether there's anything about the clinic that makes people uncomfortable about filling their prescription. So maybe not so much here, but so there's a range of options that you could use here. Surveys, I think, are a little bit less helpful, I think, because they really don't tell you about the why, right? So if you want to look at why, we're looking much more at the qualitative methods. And now the final question that we wanted to answer. So we already went through the first three, which is what you want to learn, what type of data you wanted to collect and from whom, and then your methods. And then the final one is about the resources that you need. And this is so critical. And here, I'm not going to give you a full kind of like how you budget for these methods or something like that, but just a couple of tips. So one of the things is, of course, when you're doing interviews or focus groups, I mean, the interviews should be trained to reduce bias. And remember that data is not generalizable. So sometimes you'll spend good time and resources in doing all of these interviews, and then you go to your boss and you're so proud of your report, and the boss says, but does that apply to everyone in the Tallahassee office? No, it does not. So that's just something just to keep in mind before we spend a lot of time, is that there is that limitation on the data. Similarly, focus groups need good facilitators to manage group dynamics. And again, data can be difficult to analyze. And sometimes that takes time. Sometimes it means somebody really sifting through the information, classifying it. You often want two people to analyze that data. Again, that's, we're not going to get into the details of analysis today, but again, it's about kind of the time and the resources to get that done. Observation can take a lot of time. Again, going back to Caroline's comments about the bias, one of the best ways to reduce bias is to observe for a long time. So you need to have the time or be quite patient. And then surveys, they can be expensive, and you require sampling and analysis skills, but also survey design skills. So these are all things to think about when you're doing them. But on the upsides, for example, surveys, if you're doing it correctly, then you do have generalizable data across your whole population, and that's something that's really helpful. Okay, questions as we wrap up.
One question that I think is an interesting one for Marie-France would be, what about semi-structured interviews? How are they different from surveys?
So semi-structured interviews, so we can start with the two extremes, right? So surveys have questions, closed questions, meaning it's either a yes or no, or from a scale of 1 to 5, or something that already the category is already set. An interview has an unstructured interview, which just have very broad questions like, could you tell me about your journey to arrive to the U.S.? And then it's like very, very open. Semi-structured looks more, in my mind, looks more like it is an interview. So it's going to be more open, but you might have particular sub-themes that you want to hit on. So for example, if I say, okay, so I want to ask them about their first experience in going to the physician and see how that went, but you might want to make sure that you touch upon, whether their language skills was an issue, whether they had issues with their health insurance card, whether they felt listened to and cared for, whether there were some things that confused them about the process. So you might have a general question, but then you want to make sure that you ask follow-up questions or prompts to make sure that you gather specific information within that response, as opposed to just saying, tell me the story of your life, and it can go in 20 different directions. There's no kind of right and wrong in terms of it's not like one is good and one is not as good. I tend to recommend open-ended surveys. Like, for example, if you do want to collect 5 stories, open-ended tends to be quite good with that. If you're wanting to hear about satisfaction about a service and their feelings about it, but you want to make sure that you hit upon particular themes around what IRC provides or how it can help them better, and you want to make sure that you hit those points, that's better. Also, semi-structured interviews tend to be good for people who are not extremely practiced interviewers. So it helps them think through, like, instead of having to just have all of these sub-questions in their minds, they have it on a piece of paper so they remember to prompt, oh yes, I did want to ask them about, you know, their first time using health insurance and not just kind of the broad experience. So yeah, so that I hope that answers the question.
Great, thank you. Another question. At the top of the presentation, we did mention document review. What's the use of document review when it comes to data collection?
Yeah, it's true that we did not really touch on that. So document review can do several things. One of the things is that we want to make sure that, so first, before you spend time and money on collecting data, you want to make sure that the information is not already existing in your case management information. Or sometimes, especially when you're asking very sensitive information, you might want to make sure, you know, and you've already interviewed these people about their experiences, you might not want to ask those questions again because there can be very difficult to bring those topics up again. So it's so document review can be about kind of using monitoring data that we have, using case management data that we already have. But for example, so one time I had to do an evaluation of a particular pilot program. I looked through the curriculum for that to really understand what the curriculum was about. So it really helped me understand what the program was about. The way that I tend to use document review is it supports an evaluation. So it's you can do an evaluation that's just about document review, but I think in a lot of your cases, you may use it more as a support. So you can say, well, we talked to clients and they told us this, and also according to case management data, this is the case as well. So they can support that information. But it's also just to make sure that we are using all the information that's already there, that we're not collecting information that's already existing. But that can be some of the ways that you might want to use document review.
Great, thank you. So we had a really interesting comment from Faith in the chat. She mentioned that in the torture rehabilitation field, some clinicians have stopped giving exit interviews because they found that clients or patients were biased toward the provider and they would not provide critical or negative information about the services received, both because of the power differential and because they felt that they couldn't criticize that care. So I was wondering, given the fact that clients might not be comfortable answering honestly in exit interviews, what other ways would you recommend to get client satisfaction feedback?
That is a great question, and it's one that we struggle with all the time. You know, I think no matter how experienced you are in research and evaluation, this is one that you face. I know certainly in the field where I worked, clients are experts at telling you what you want to hear. They're just amazing at that. It doesn't matter what level of education they have. They're excellent at figuring out what you want to hear. A couple of things. I mean, sometimes it helps that it's an external person to ask those questions. Depending on the situation, it would be very hard in your cases, I think. But sometimes the external person does not even tell you that they're there on the behalf of the IRC. But again, that could be kind of awkward. So it means kind of like contacting them and then saying, I'm just here to ask you some questions. Will you answer, but not tell them that it's for the IRC? I think it's not quite appropriate in these cases. Just something to think about. Sometimes we are asking inadvertently some leading questions, and sometimes we may want to reframe things around, you know, kind of like what was good, what was challenging, and to try to bring that up a little bit more. It could be in some cases, for example, in focus groups, that people tend to kind of feel more intimidated with bringing up some of the negative things, they might be much more comfortable with a survey. For some sensitive information, what we found as well is that if you give a survey for people to answer online, or or sometimes it can just be like a recording, and then they're walked through where to click to answer what. People tend to also answer more truthfully, and this has been tested as well. So that's another thing too, that you can just give them an online survey that's anonymous, and then they can provide information that way. That tends to help. All that being said, it's an ongoing challenge. If you're thinking that this challenge, I think it also means that you're good at it. You're thinking through evaluations and you're thinking through research, because I think it's more risky to think that people are not biased, because then you're risking thinking that information that you receive is always exactly what it is, and you take it at face value. And we need to take that information sometimes with a grain of salt when it has to do with satisfaction with our services.
Here's another question. Would you be able to talk a little bit about mixed methods?
Sure. I mean, that's quite it's a big question. So personally, I love mixed methods. So mixed methods is when you're using both qualitative information and quantitative information within the same evaluation. So for example, you can say, I'm gonna, and so I would maybe say a couple of things, since we're a bit short on time. So one of the things is that it's great to it provides you a much more holistic view of a particular problem in some ways, depending on your topic, depending on your questions. It helps you gain a fuller picture. One of the great things too is that you can sequence. And by sequence, I mean, so an example of this is that you can say, okay, so I want to ask people about whether they feel included in their communities. So you could say, I'm going to do a small study, and first I want to ask people what does that mean for them to be part of the community, to really understand what are the terms that they use to describe that, so that when we ask them about it, it's using terms and words that make sense to them, because being part of a community means something different to different people. So maybe that we're going to do that first, and then we're going to do that in the focus groups or interviews. Then we might want to use that information about what does that mean for them to be included in the community, and do kind of a big survey that looks at particular aspects of that, for example. And then you take that information and you say, okay, so people are telling us that they're feeling very welcome, but then there might be some information that tells you that there are specific aspects to community inclusion that are maybe more challenging, or from the information that you're receiving, it's not really clear what's happening. And you say, okay, so we will follow up with, for example, with individual interviews with people to really understand what is really happening there. Or, for example, if information came up that seemed to indicate that people of a particular group, or, for example, if women, or, for example, young women in particular seem to have specific challenges, let's have focus groups with those people to really give us more information. So one of the great ways to do mixed methods is that kind of sequence, right? Is to think about, okay, so when do I need things about opinions, feelings, what things mean to them as people, and where do I need information that's like really quantifiable, and how can I what needs to come first to be most useful to the evaluation. So that's one thing that I would say. Something that's very difficult with mixed methods, and I found this in even the most expert evaluations, is that it's very difficult to bring those two together in one good report. So that's something that if I do find good examples, I'll send them to Jamie and Meg. But it's quite difficult to bring those two sites together. I think sometimes they come up as a little bit disjointed. So that's one of the trade-offs. Sometimes that's a little bit difficult.
Great, thanks, Marie-France. I think this has been very informative. And if you do have any further questions, please do email us at meta@rescue.org. We'd love to hear from you, and also revisit that link that I shared to join the discussion on Meta's website. We would love to hear from you about the methods that you have used, challenges that you have faced in choosing data collection methods, and also, the forum provides a bit of opportunity for you to get some input from your peers as well. So please do visit that. I'm going to post this link again. So do take a chance to visit the forum, the discussion forum. We also have resources that you can visit at metasupport.org, and the webinar recording will also be posted. You can forward this on to others who may not have been able to participate in today's session. And you can find other recordings of past webinars also on the website. We look forward to hearing from you, and have a great day. Thanks for joining.